So thank you for your time, first of all. I have a few questions for you. Could you briefly share on the background and how you became interested in genomic medicine?
So genomic medicine has evolved very rapidly in the last 2 decades. When I was a trainee, it was purely a histopathological diagnosis. Lung cancer was only adenocarcinoma, squamous cell carcinoma. And then slowly new and new discoveries started coming, and we realized that adenocarcinoma is further divided into EGFR and then ALK, then ROS. And now we have more than 15 or 20 different types. And it's important to know each one of them because it determines the actual treatment the patient is going to get. And that is how the interest evolved, because you're able to tailor or personalize the treatment according to the patient's tumor genomic profile.
Sir, in your practice, what are the main areas where NGS is making a difference for patients?
NGS is actually making a difference in almost all cancers now. But there are certain cancers where it has kind of become mandatory. For example, lung cancer, where almost 50 to 60% of patients might have an alterable mutation. It is also being used for prognostication in breast cancers. It's being used in brain tumors. It's also used in acute leukemias, both lymphoid and myeloid, to identify genes which will determine the risk stratification. So it's a span spectrum. And there are tools available published by the ESMO and ASCO called the SCAT tools, which are helpful in deciding where NGS is helpful and what is the evidence behind using this test in those diseases.
So how do you usually convince common people who have no idea about NGS to undergo this test?
Yes, NGS can be a bit complicated. Even for physicians to understand how NGS works, it takes them a bit of time. So we have to tell these people that, this test is important, needed to identify the right treatment. So you need to have the right drug for the right patient, for the right disease. And NGS simplifies that. It also gives them more therapeutic options. And also, if you identify a targetable mutation, it will help them to improve their lives, the quality of their lives, and also prolong their lives. And NGS also plays a big role in hereditary cancers to look at germline mutation. So it's not only for deciding therapy, but it's also for preventive strategies. Therefore, you have to explain to the patients in simple terms that we are looking deep into the genes, the cancer genes, to identify specific abnormalities which is different from the normal population. And based on that information, design their treatment or give them drugs which will work against this specific abnormalities in the genes.
What would be the common challenges that we are facing practically with regards to the turnaround time, cost, and the interpretation of results?
The challenges are multiple. So I would say the first challenge would be in certain diseases like lung cancer tissue. The tissue is the issue. So you might not have adequate material. The second challenge is that you need to have adequate quality control. Just because you have an NGS lab doesn't mean that you can blindly trust it. You need to have a good team, a good scientist, good analysis and interpretation, and an accredited lab is essential. The other challenge is definitely the cost. Although it's come down considerably, but it's still beyond the reach of most of the patients in the country. Then also validity and reliability. There are so many tests available. You need to know which panel to choose, which gene to choose, which platform to choose. There are currently not much consensus on what is the best panel or best instrument. So these are the challenges which we face. And obviously turnaround time. Sometimes it can take many weeks, and we as clinicians need to take a decision immediately within few hours to few days. So that's been an issue with NGS, yeah.
Let's move to the hot topic, which is AI. So what do you think about NGS and AI, and what will be the advances that we'll expect?
So AI is everywhere now, and all of us are using ChatGPT. And AI can look into things which the humans cannot identify. It can look at patterns. It can reveal new things which were not known. So it's exciting to use AI, and especially when you have a lot of data, big data at a population level, it is helpful, and for data analysis as well. But at the end of the day, I would still be cautious. Sometimes AI can hallucinate, can give errors in reports. So we need a human behind the AI to ensure that the report makes sense. So yes, AI will be there, but they cannot replace the human behind the NGS, and we have to work together with AI. AI won't replace everything, but AI will make our life easier.
And last question, a few words about the NGS quality and reports in our CBMD lab in our Cancer Institute.
So the Cancer Biology and Molecular Diagnostic Lab at Cancer Institute is one of the leaders in the field of genomics in India. It is well recognized both in India and abroad. The department led by Dr. Vijayalakshmi has maintained excellent quality, and we as clinicians are very happy with the support given by the lab. Rapid turnaround time. We can easily reach out to Dr. Vijayalakshmi and the team to clarify any queries. And within a short period of time, they have established a big lab, their quality reports and consistent reports. So this has been a great addition and achievement for Cancer Institute. We not only get samples from Cancer Institute, but there are a lot of institutions and individuals who send samples from outside. So wishing the lab a good and bright future.
Thank you, sir. Thank you so
Thank you
much.
very much.